On November 30th, 2010, the National Association of People with AIDS and the Center for HIV Law and Policy held the first congressional briefing on HIV criminalization.
We welcome you and thank you for coming and being with us this afternoon.
The legislative director from Congresswoman Barbara Lee's office addressed the audience.
The conversation that we're having today about criminalization is coming at a very crucial time, and it's really part of a larger global discussion that we're having about human rights and the violations that occur for people living with HIV/AIDS or vulnerable to HIV/AIDS. And the goal of this commission is to really examine the legal barriers to carrying out effective national AIDS responses and to provide a human rights-based approach and recommendations to overcome these challenges. So we must be forward-thinking in the way that we address the AIDS epidemic and not allow for de facto discrimination of people living with HIV in any context.
In the Life media presented a clip from their December 2010 segment, Legalizing Stigma, highlighting the human cost of these laws.
He was accused of spitting at a guard, biting a guard, things that you really can't, get infected for HIV for.
The judge sentenced him to 25 years in jail.
But at that time, we all realized that was a death sentence.
While producing our segment, Legalizing Stigma, which looks at laws criminalizing HIV exposure and transmission, we researched media coverage of crimes involving people who are HIV positive. The following headlines are a small sample of what we came across. HIV positive man spits blood at police officer. The charge is murder, the weapon is AIDS. AIDS monster from Brooklyn remains in prison despite completing sentence. Inaccurate and distorted headlines like these are rampant across the media landscape. At this historic briefing, advocates discussed the public health consequences these laws create, the current evidence about their impact, and what resources are available.
If we're going to deal effectively with ending criminal laws that single people with HIV out for special treatment, we really need to educate the public, prosecutors, people in the criminal justice system, the broad community, not only about the real risks and roots of HIV transmission, but the real public health consequences of these laws.
The briefing ended with Monique Howell, who shared her personal story with the audience.
Just listening to all the laws and the policies and everything about HIV criminalization, I can truly put myself in what everyone was saying. I was diagnosed in 2005 from my very own spouse, someone that I thought that loved me, and I was also pregnant when I was newly diagnosed. However, a year later, after finding out about the affair from my husband, I was vulnerable at the time, wanted to be loved. This young man comes to me and I engaged in sexual activity with this man. Yes, I told him to get a condom. Of course, he didn't listen. I didn't know how to say, I'm HIV positive. I couldn't get those words out. Hurt, disgusted because of what my ex-husband had did to me. I allowed it to happen. Was in the military at the time, and that was it. 5 months after the incident, I sure enough got a call. I went through trial for a good 6 months. They couldn't come up with a verdict. They questioned all my family and friends. All they looked at was HIV. This lady is HIV. She just slept with this man. Thank God, through his testimony, he said, I don't want anything to happen to Monique. They asked him why. They said it takes two to tango. I'm just as grown as she is. I'm just as fault as she is. I think the laws do need to be some changes in it because we as HIV, we live in just like you. I don't think I'm out here to harm anyone. I think I'm just want to be loved and just want to have a friend and just like anyone else.
Let's face it, mainstream lawyers are not trying to figure out what to do about someone who has HIV. They're not. They haven't been for the last 30 years. They're not about to start now. But when they have to in their practices, let us hope that we will have resources available that they will make better decisions than some of the decisions we are seeing. So that will be the goal of the American Bar Association AIDS Coordinating Committee. And I would like to ask all of us as we leave here today to think about what it is that we can do in our individual workplaces, the organizations we're affiliated with, to change this map.